wasting much time, I go straight to our first speaker of the day. First speaker of today is Dr. Richard Munang. I will read his bio and hand over the floor to him to speak. Dr. Richard Munang is the United Nations Environmental Program, UNEP, Head of Global Environmental Monitoring Systems. Before his present appointment, Dr. Richard was the Deputy Regional Director of UNEP Africa Office, where he led and guided the seamless execution of UNEP's programs in Africa. Specifically, he led the implementation of the UNEP delivery model at both strategic and operational levels, using a unified approach to involve the entire UN development system. He also innovatively devised thought solutions in key cross-cutting areas like food systems and One Health, highlighting the role of the environment in practical solutions, leveraging on data-driven approach to inform policy and investments. Dr. Richard was also the climate change coordinator of the same office, where he guided the implementation of UNEP's climate resilience development strategy at national and regional levels, leading programs on climate change, innovative financing, food security, and clean energy in over 50 countries, and also providing technical support and capacity building to ensure climate action policies and investments are informed by the latest science and empirical data of what works. He later worked on ecosystem-based adaptation, EPA, for mountains, food security, coastal ecosystem, low emission development, and climate action projects. When he joined the African office, he pioneered the first UNEP Africa Adaptation Gap report series, which helped to galvanize a coherent continental strategic climate policy position, elevating adaptation to be at par with mitigation, which is one of the priority on the continent. Dr. Richard, thank you very much for joining today's webinar. I hand over the floor to you now. Thank you.
Thank you very much, Dr. Boba, a very good friend, and to all the organizers of this very amazing and timely discussion, very timely than ever before, and to all the invited guests, distinguished ladies and gentlemen. My discussion today is going to be on this very timely subject, but I'll start off with this African proverb which goes that if you have health, then you have hope, and then you definitely have everything. What this tells us is that the importance of health is like having everything. And when we put a monetary value to this, the global economy, as much as 15% of the GDP every year has been lost as a result of premature deaths and lost productive potential. On the flip side, what we do know is that better health can boost the global economy by up to 8%, which is about 12 trillion in the next 12 years from today. But we also know that investing $1 for better health translates to a return of up to $2 to $4 each and every year. But the question then becomes that if the message is as clear as it is today, the understanding that good health is imperative at both personal and economic scale, it therefore means we need to start understanding that the fact that threats to health through the air we breathe, through the water we drink, and through the food we eat are undeniable, and therefore continue to increase in tandem with environmental change, as we all know. So the health of our environment, which underpins our livelihood, is continuously being deteriorated, and at the same time undermining what is called planetary crisis, which is climate change, nature biodiversity loss, as well as pollution and waste. And this directly responds to the environmental deterioration that has been an escalation of health risk. But then this takes us to the point because the science is unequivocally clear, telling us that because of the changing climate, increased temperatures are accelerating the multiplication of microbes and creating the conditions that are favorable with a shift of disease pathogens to newer areas, only helping to precipitate diseases that we see today. Increasing emissions As the UNEP emissions gap report that was released in November 2023, it showed that climate change is on the rise, aggravating almost 60% of all infections that we see in the world. Antimicrobial resistance, in which Africa is registering the highest number of deaths, is accelerated at higher levels with increased temperature. But when we look at what is happening today, over half of human pathogen diseases are aggravated by the changing climate. Pathogens that could cause foodborne diseases, infections are sensitive to temperature because warming and wet conditions stimulate bacterial growth. But considering that the global temperature warming as we speak today is almost above 1.1 degrees, and as I said, the UNEP emissions gap report of 2023 projecting that the temperatures will go up to 2.9 degrees by the end of the century if we continue on this same path. With Africa warming twice as fast as the world, it means the continent will only face major climate-induced escalation of health risk. But climate change aside, the destruction of our biodiversity is leading us not only to reduce the buffer between people and animals and human habitats, but increasing the risk of zoonosis. Accordingly, it is estimated that up to 60% of emerging infectious diseases, zoonosis in Africa has seen a jump of up to 63%. But over 30 new human pathogens that have been detected in the last 3 decades, 75% of them have originated in animals. The list goes on. On pollution, the continent of Africa is no exception, with over 700,000 Africans dying each and every year. These are not just statistics. These are human beings, our brothers and sisters, who are dying for committing no crime, but just because they do not have alternatives because of indoor pollution. And up to 115 people die every hour in the African continent from inadequate sanitation. But with all this that we know, we also know that the interaction of health and the environment does not occur from the risk dimension alone. We know that environmental action is a significant source of health solutions. If we were to take a very practical example today, with over 50% of the currently approved drugs that we do know across the entire world are either directly or indirectly derived from natural products, and investing in simple solar dryers that can be able to reduce post-harvest losses, that can be able to dehydrate our food, can cut emissions by over 200,000 tons of carbon dioxide compared to alternative fossil fuels. This is meaning that they can also reduce the risk of aflatoxin that can be reduced by up to 54%, while increasing over 30 times more accessible opportunities for communities as they better their health, as they reduce post-harvest losses. So such accessible solutions for the continent are critical, especially as we understand that the African continent have the highest per capita incidence of foodborne diseases, pathogens multiplying faster at higher rates. Then this brings us to the topic of today. With all this, we understand that the intersection of environment with health, it therefore behoves us to understand the role of big data in all this. Because big data, as we do know, is also a source of solution, but it should not only be to dictate the problem, but it should also be to provide the solutions. And so big data solutions become very, very urgent. Why does it become urgent? It becomes urgent because big data solutions can create the bridge between the risks and solutions to infectious diseases. Even more encouraging is the fact that through the present day internet connectivity and the mobile revolution, big data applications in health are much closer to each and everyone in the continent. For example, if we were to look at what happened during COVID-19, what happened was that we saw the recordings of not just the information, but we saw that during the peak of this worst pandemic, which was the worst in over 100 years, social media platforms became the hub of sharing data and information about the trends in the pandemic to enable making of real-time decisions, even down to the family level, where it matters most, was actually utilized. And for example, in one leading survey, about 70% of respondents use social media actually to seek information about COVID-19, and 60% did share information about the virus on social media. In the African continent, as we know today, over 40% in some instances, use social media in some of the most connected countries, including Nigeria. As if that is not enough, on a very sophisticated aspect, right now, anyone across the globe and in the African continent can have access to real-time air quality data for different cities in the continent. Whether you're in Lagos, or you're in Abuja, or in Yaoundé, or in Douala, or in Nairobi, one can be able to use what is called open source platforms to be able to access these. And this is thanks to the merit of these open source platforms that are actually monitoring air quality and providing this information that is critical, and also a critical indicator of the risk of different infections, and particularly respiratory infection. We also have the humanitarian drones, where Africa is a global leader, closing the health infrastructure gaps and reducing delivery times of critical medicine by up to 16%. But with all these that we know and the information that we do have on big data, the question then becomes, why haven't we closed the gap with solutions? And the answer is simple, because big data applications have largely been one-dimensional. They've been one-dimensional, focused more on projecting the challenges, the problems, rather than also projecting the socio-economic opportunities that are critical to trigger solutions uptake. A practical example, if we were to consider real-time air quality monitoring that I've just discussed, while there is a myriad of open source data, what we do here most of the time is the sensors giving the state of air quality. That is okay, but we do not go from there. What it does is that it stops only at projecting those challenges, but do not go from there to project the opportunities inherent in addressing air pollution. The humanitarian dreams that I've mentioned before are known more for closing the health infrastructure gaps, but instead of the job opportunities and the income opportunities that could also be projected utilizing these big data approaches, this seemingly is missing in this equation. And it is in leveraging these big data solutions for holistic monitoring that goes beyond just dictating the risk, but also showcasing the solutions that the United Nations Environment Program is championing a new approach called early warning for the environment, where we move from monitoring data of the problem to actually monitoring also the solutions that could be matched not only at the mainstream, but also at the upstream, so we can forestall the problem. As an example, if we were to look at the extensive air pollution monitoring that is being put in place today, where, as we're speaking today, record 6,000 cities in 117 countries across the entire world do monitor air, but yet 9 million people every year die across the globe. When we know the problem, it tells us that these over 9 million people that die as a result of pollution, indoor pollution, dying prematurely each and every year from air pollution related infections is something that could actually be addressed, and Africa is no different. About 19 African countries, as we're speaking today, already have air quality standards and the ability to monitor air quality, yet the air quality does not meet the World Health Organization standards. And in some cities, with air quality monitoring services, particulate matter levels are over 4 times the World Health Organization limit. But what the early warning for the environment approach brings is different. It brings big data from a different dimension. For example, the state of air quality by matching to the upstream causes, whether we're talking about vehicular traffic or we're talking about deforestation. If we're talking vehicular traffic, how do we match it to non-motorized systems like cycling, like e-transport solutions? And this can actually not only provide an opportunity to create investment plans, but also create enablers and policy enablers and enabling environment that can actually help in taking up solutions where it's been shown that air quality solutions, where every $1 in air quality solutions translate to up to $30 in economic benefits. And this can also help inform policy enablers like break for solutions, social enablers like skills retooling for our youth to be able to execute these solutions. We therefore urgently need to move away from leveraging big data to project the problem and leverage big data to project the solutions. That is the way forward for Africa's health. That is the way forward for Africa's environmental solutions that actually help to ensure that big data for effective health surveillance in Africa can actually move forward. But I would like to leave you with these following points to ensure that at least as we move forward with this approach of big data, we must be able to take into consideration The first is we must combine health surveillance and early warning for the environment at once. Why do I say so? I say so because the reality of what we've seen in the continent and even the world is that the environment is both a source of risk and it's also a source of solutions. And the second is that big data solutions are not lacking. They do exist, as I already showcased. But what is needed is how do we leverage this to be able to ensure that at least we expand beyond projecting the risk, to start projecting opportunities and ensure that surveillance systems that need to plug to environmental monitoring systems project the state of the issue, the state of pollution, the state of biodiversity loss, the state of the changing climate as a bearing of the risk, but move beyond that to also ensure that we strengthen health through planning and environmental monitoring actually moves beyond this. The example of pollution trends such as effluent release, which we do see each and every day from industrial, from domestic, as well as agricultural sources, are an indicator of infectious disease outbreaks and causing antimicrobial resistance in millions of people across the continent. And such data should be part and parcel of health planning. But as time moves on, we leverage the environmental dimensions of solutions that we do see across the continent, and we do champion them like biodigesters that are actually helping to intercept waste, but also help to translate these solutions of intercepting waste to reducing this effluent and providing an opportunity to provide biofertilizer that provides an opportunity for nature-positive solutions. This is not only reducing degradation of the environment, but at the same time, also reducing effluent leach into the environment. And this means, for example, if we were to take biofertilizer, which is needed in the continent today, that can substitute up to 50% of chemical fertilizer in the continent, this will lower pollution. This will tap into a growing market that is at a compounding rate of 5.9% as we speak today. And such solutions impacts needs to be monitored in tandem with the upstream risk and also the investment enablers to plug into a comprehensive integrated information packet to give us a health surveillance system that will enable not only health systems, but take full advantage of environmental monitoring to address so. The second aspect that is quite very instrumental, we must leverage the communities. These issues cannot be discussed in silos. Leveraging community engagement and citizen science is the way forward to bridge big data. And this is, to me, the most important point. Why is it the most important point? It is the most important point because local communities are a ready source of data to complement health surveillance. If we were to take, just for example, the African setting, which is made up of cooperatives, with most of these people having cell phones and having WhatsApp groups, if they were to see a problem upstream, for example, the burning of charcoal or leaching of effluent from fertilizer application, and they took a photo of that and share, and that information get to health officers that can be able to understand where is the problem, and we engage the requisite authorities that can be able to intervene with the solution. We'll be leveraging the community to be able to monitor, to be able to early warn on issues that are actually affecting not just our health, but also affecting our environment. And the application can be able to unlock not only opportunities, but also be able to leverage and give us information that we can be able to act on. And that takes me to this very important aspect, which is how we can then be able to leverage diverse data sources that we do have, whether it is from primary to secondary to tertiary data, to enrich our monitoring system so that at least we can be able to take this data and make it a lifeline for monitoring. The cost of setting up a single environmental monitoring initiative is quite very, very expensive. But as I did mention earlier, across the entire world, we do have open source monitoring that over 6,000 cities in 117 countries in real time as we speak today, you can be able to monitor the air quality of Lagos. Platforms like AirQO or IQ Air across the world are providing these services. But the question then becomes, how do we leverage this data to add to the primary data that we do have? Do we have to always deploy very costly instruments to be able to gather information on what we already have? For example, when it comes to monitoring the impact of solutions and investment enablers, as I mentioned, we do not have information here. But secondary data of data sources can be able to provide this information. For example, citizen scientists in communities can provide information on turning agricultural waste to fuel briquettes that is taking them off depending on charcoal, of turning agricultural waste into biogas that is helping them to move away from depending on kerosene and etc. These are opportunities that can actually be able to be leveraged, and this mix of data put together can lower the cost of monitoring, but at the same time provide information both on solutions, both on where the problem is, and that will help us build a very strong integrated health system. That's the power of big data. And it takes me to the fourth point. We must be able to ensure that at least we tap training systems to close the gap between environment and health. Why do I say so? I say so because there is an urgent need of training of our health professionals to include the environmental angle as part of both the risk and of both the solution. In this way, if we take indoor pollution risk linked to unclean cooking on one side, to what extent can we start to ensure that we integrate the training of our health professionals on clean cooking, like burgers, on clean cooking solutions like fuel briquettes that are made from agricultural waste? This way, we will be bringing an environmental solutions and making healthcare professionals training increasingly prioritize the One Health paradigm in their curriculums, and this way it will become also part of their prescriptions. That takes me to the fifth point. Regardless of what we say with big data, if you cannot leverage big data to be able to help inform investment plans to attract the private sector to invest, we might not make inroads. I say this because investment planning, turning policy into an attractive investment plan has not been the norm in the continent. Yes, we do hear of plans. Yes, we do hear of policies. Very important. But where do we move from there when we have not turned them into investment plans? When we know that health solutions in the continent, if you take an example of a healthy biodiversity that translates to the pharmaceutical industry, which is valued at over 22 billion annually in the African continent, in 2022 alone, with an annual compounded rate of over 6%, what this tells us that despite the fact that this is only going to grow up to 90% of drugs, 99% of vaccines consumed in the African continent still get imported. That's okay, but it signifies a critical market. But how will people invest when there are no investment plans that elucidate how protecting our biodiversity will catalyze the growth of the pharmaceutical industry in the continent, which is critical to incentivize our biodiversity protection and conservation towards a One Health enterprise? It therefore means we must go beyond this and leverage clean energy. For example, solar cook storage, solar dryers for healthy value-added food systems, which can also unlock up to about 320 billion in annual enterprises. This is an opportunity. Why I brought up this point is because we need to ensure that investment opportunities be presented side by side with the plans that we do have for One Health. That takes me to the last point, which is the advent of artificial intelligence, machine learning. How do we leverage it to refine environmental monitoring for health? And I'll take about 3 minutes here because this is very, very crucial. I have been in this space and I understand a thing or two about it because artificial intelligence is with us to stay. But at the same time, we know that it stands out as a core area of big data. It is, which has the potential of contributing up to about 15.7 trillion of the global economy in the next 6 years from today. That's by 2030, with 1.2 trillion US dollars accruing to the African continent. But more importantly, what is very, very key is that when it comes to environmental monitoring and health, artificial intelligence has the potential of streamlining, enhancing efficiency, but at the same time also multiplying the capacity of data analytics to ensure that diverse data sources, whether they are upstream, as I did mention, or downstream, or linkage to solutions to enable decision makers to deduce newer, more novel solutions to address health risks through the environmental lens in a very contextual way becomes possible. If we were to take, for example, the air quality data aspects that I did mention, where the risks from different sources, whether we're talking indoor pollution, or whether we're talking vehicular emissions or sandstorms, or we're talking about farm fertilizer, or talking about livestock waste, generated through different methods, whether the data is coming from citizen scientists or open source monitoring or satellite imagery or land-based reference, as we do know, or great monitoring sensors. The most significant risk sources that will generate the most significant impact in terms of averted disease in a country can actually be analyzed utilizing artificial intelligence. It can analyze data on solutions on impact. It will reduce the time that a human being could have used to do. It can actually analyze investment options that should be prioritized to yield the highest return in a country or in a locality when a health opportunity is applied. And another example that is very clear, many of us, and we see it even in our communities, is that we do talk about youth unemployment, but yet the problem is identified. But the solutions are discussed, but the investment planning and the returns on those investments and the enablers that are supposed to be put in place to fast track the uptake by ordinary citizens and our young people are not in place. But with artificial intelligence, with all these data sources, upstream risk, midstream risk, match to solutions, combined with enablers, artificial intelligence can analyze and provide this information. And that is the big data approach that we are utilizing already to actually showcase how we leverage data, not just to identify the problem, but to drive solutions. And this is an opportunity that citizen scientists data that I did mention earlier on upstream risk, for example, like charcoal burning, open waste dumping, open waste burning, all which contribute to air pollution, such as particulate matter, methane among key risks to respiratory health, to actually be leveraged and the data input into an AI analysis application and the upstream data from open source analyzed to be able to provide the impact on solutions. This will then provide us with an opportunity not only to create an environment that big data becomes useful away from projecting solutions, but ensures that the computing power of artificial intelligence provides the component of data analysis that needs to be prioritized in every sphere of health and environment to ensure that the power of big data for health surveillance from the environment, as I've discussed today, is fully unlocked. But as we do this, we need to reimagine not just leveraging big data to be able to address health challenges, but to transform Africa's economies. Because a healthy population in the African continent is paramount, but a healthy population that cannot be able to feed herself, that cannot be able to create jobs for our own people, will not be able to take us forward. And therefore, the early warning for the environment approach that I've mentioned is the bridge we need to leverage that big data towards strengthening health surveillance, but at the same time tapping the environment for solutions to forestall risk, as well as we unleash the opportunities. So let's join our hands today to reimagine the application of big data through these approaches that I've mentioned, because where there are many, it is said that nothing goes wrong. Thank you very much.
Thank you very much, Dr. Richard, for that very, very loaded presentation. I'm sure that for us to have an understanding of your presentation, I will have to go through it maybe 3 or 4 times to be able to digest all the information you loaded in one presentation. It's almost like presenting a PhD viva. Seriously we appreciate your presentation, and we are going to, hopefully you are going to give us the permission to share it with participants, so that I'm sure they will need to digest and go through it many more times to have a very detailed understanding of your presentation. You know, you went from the impact of climate change on health down to definition of big data and the importance of big data and the use of big data, not just to identify problems, but also to be a driver for solutions on the continent, and how we can use big data to drive surveillance and drive solutions, and also use big data for policy, which is very important, because policy is the foundation of whatever you're doing. And if you miss it at the point of policy, then your implementation would definitely be very faulty. So using big data and artificial intelligence to drive policies and strategies on the continent has become extremely important. And these are different areas of your presentation that that you dipped into and you give very detailed explanation about. So thank you very much, my very good friend. We appreciate you as usual, and it's an honor to have you again. And hopefully we know we have very, very good things to do together this year to see how we can both contribute to making our continent, Africa, a better place for all of us to live in. So without wasting much time, I want to appreciate our participants too. I can see that we have almost 100 participants on the platform now from different countries, from Philippines to United States of America to Malawi to Kenya, Nigeria, Ghana, different countries. We appreciate you for joining this webinar again today. You are the reason why